And welcome back to The Factor Uncensored. Many parents are concerned about their children in this climate of COVID-19, and we have Dr. Anastasia Gentles here on The Factor Uncensored to talk about Kawasaki and how it has an impact on those who have COVID-19 and children. Dr. Gentles, tell us about that.
So Kawasaki syndrome is a syndrome that we see in pediatrics, and we've seen it before. It's not a new thing. It's just that now, during this pandemic, we're seeing clusters of kids come in with Kawasaki-like symptoms. It's not exactly the same as what we've seen in the past, but because we're seeing clusters, they're trying to figure out, is it associated with the COVID-19 infection?
And when you say Kawasaki-like symptoms, what are the symptoms? What can we physically, visibly see? And what type of, I guess, distress would the child be in if they had Kawasaki?
So traditional Kawasaki, and it was first found in kids in Japan. That's why it's called Kawasaki syndrome. And the syndrome includes kids with a high fever for several days, for usually 5+ days, a rash, a conjunctivitis, which means redness in the eyes. A lot of kids will have swelling in their hands and feet. But what we're seeing now with the clusters of kids that are coming in during this pandemic is a little different, and they're calling it more like a Kawasaki-like toxic shock syndrome-like syndrome that is mimicking Kawasaki. So they're trying to figure out, is it connected? Is there some connection between these kids? So I will say that a lot of the kids are negative for coronavirus, but because the cluster is coming in at the same time, they're trying to figure out, is it the same thing?
So how are doctors treating it?
So when kids come in, there's no, when we see traditional Kawasaki's, we use something called IVIG with it. But now when the kids are coming in, they're basically using supportive care. Some of the kids are ending up on mechanical ventilation. And then a lot of the kids are having blood pressure issues because Kawasaki's is a vasculitis, and you hear the word itis, that means of inflammation. And for Kawasaki's, it's an inflammation of blood vessels. So if you get inflamed blood vessels and a toxic shock-like syndrome, you get blood pressure issues. So we're basically having to support these kids and keep their blood pressure high, and also support them in other ways. But importantly, the kids that are coming in these clusters are not having problems with their respiratory symptoms like adults and older kids. They're not having the cough that you see with traditional COVID-19 infection. They're having mostly blood pressure issues.
And so what would be the first symptom that a parent would notice, and how soon should they get their child to the doctor?
So what we've noticed, or what the reports, there's only been a few. I'll say this outright, that it's only been a few kids. It's very small numbers. So we can't say, oh, this is what your child is going to have. But a lot of these kids have GI symptoms, meaning vomiting, diarrhea, and severe abdominal pain. So if your child has any of those, make sure that your pediatrician sees them and somebody takes a look at them and talks you through that. So common things are common, right? Little kids are going to have stomach bugs. So not every stomach bug is going to be this, but it's something where you just have to keep your antennas up and keep an eye on the child and how they're looking.
All right, doctor, we want to thank you for joining us here on The Factor Uncensored. And don't be concerned about me. I was just cleaning my garage. There's a lot of dust in there, so I don't have the Rona.